Sinusitis is an inflammation of the mucosal surface of the paranasal sinuses. This common disorder develops in about 20 million Americans per year, resulting in about 5.8 billion in healthcare costs and 61.2 million work days lost annually. So sinusitis has multiple subclassifications, but the most useful definitions include acute, subacute, and chronic. So acute is 2 to 3 weeks, subacute resolves in 4 to 12, and chronic in about 12 weeks or longer. The pathophysiology is quite interesting and really related to anatomy. Okay, so most sinus disease involves the maxillary and the anterior ethmoid sinuses. The maxillary sinuses are the largest, and the fact that they anatomically don't drain by gravity just really sets us up for a good medium for bacterial growth. Sinusitis caused by viral rhinosinusitis, allergies, dental infections, fluid from swimming and diving, and anatomic abnormalities. And it makes sense that when you understand the process of cystic fibrosis, that those patients have more sinusitis. Clinical presentation, acute sinusitis is characterized by nasal congestion, facial or dental pain, headache, fever, and yellow or green nasal discharge. Okay, not clear nasal discharge, yellow or green, and sometimes mixed with blood. There's pain in the face. When you have a patient lean forward, it's worse. That facial pain is, and it's worse in the morning. This says it bends forward at the waist. A lot of times I'll stand in front of my patient, ask them to bend forward, and ask, does that make any difference in how their face feels? Palpation over the sinus that's infected can elicit tenderness or pain. And sometimes also present with a sore throat and GI symptoms from swallowing that mucus that's draining postnasally. So physical exam, you want to examine the face and palpate over the sinuses. You want to examine the eyes for periorbital swelling, erythema, allergic shiners. You know, those are those dark circles under your eyes which is really just blood vessels that are engorged. You want to also inspect the ears, nares, and throat. Transillumination of sinuses may help identify the area, but you have to be skilled in how to do it. You also want to include assessment for meningeal irritation through Kernig or Brudinsky sign. That you do not want to miss that outline, or if someone has some nuchal rigidity or nuchal signs. 10 to 12% have a dental root infection, so you also want to include tapping those maxillary teeth to see if they're tender or elicit pain. Diagnostically, it can be diagnosed from history and physical exam. There's some CT scanning for PEDS patient with recalcitrant symptoms or adults with orbital complications, with neuro defects. I mean, this can be a serious situation, and you have to never lose sight of that. Remember that CT demonstrates both bone and soft tissue versus the MRI, which is getting the soft tissue and tumors more so. Management and treatment. Treatment for sinusitis that's viral is symptomatic, bacterial antibiotics, and if adults, usually Augmentin 5 to 7 days or doxycycline as an alternative. I'll be honest, old school, not using the evidence right now. I was taught to treat longer because sinusitis can be hard to penetrate. But as I'm reviewing the evidence, and I want to practice evidence-based medicine and reduce antibiotic resistance, I do choose to go by the guidelines. Zithromycin's perfectly fine in pregnancy, or that's the best choice. There's really weak evidence for nasal steroids and saline or decongestants or mucolytics. So that's just kind of an individual provider and patient preference, but again, think about your evidence. Referrals, patients who is not symptom-free after the second round of treatment needs referral. Or if they're just progressively worsening. Chronic sinusitis with allergies or scuba divers, refer to otolaryngologist or an allergist. And so, patient education and health promotion. Educate about viral infections, how they should be treated, not be treated with antibiotics. If a URI lasts greater than 10 days and is accompanied by signs and symptoms of bacterial sinusitis, you may need therapy and probably will. So making that consideration in your clinical reasoning of how long have they been sick. Did the URI start yesterday, which I see sometimes in the clinic, or did it start 2 weeks ago? That's very important. You have to educate your patients to blow their nares gently, side effects of over-the-counter meds versus the benefit and risk. Steam and warm compresses might decrease pressure. Now, this is one of the lectures that I'm going to accompany with more reading, okay? Because sinusitis is something you see frequently, and you really have to be educated and skilled to differentiate viral versus bacterial and any complications. So please know that although this is a brief lecture, I want you to dig deeper into evidence that I present for you.